Welcome back to Ozarks Fox AM. Joining us now is Amy Hill and Sarah Wilson from Burrell Behavioral Health, who are hosting an event coming up for youth mental health. It's a conference at the Doubletree Springfield Convention Center on October 21st. Welcome, ladies. So good to see you.
Nice to see you. Thank you for
now,
having
this, I'm telling you this, when I heard about this conference, I said there's nothing more topical than a mental health conference for our youth than right now with everything we're going on in our society right now. That is something we need, and people need to get involved. So why this conference now, and how did it get started?
Well, I'll tell you a little bit about the conference first. It's on October 21st here in Springfield at the Doubletree Convention Center, and we're going to have a variety of topics, including trauma-informed classroom systems, interventions and strategies. We will talk about policy advocacy, autism, diversity and inclusion, school violence, and a lot more. And we're also going to have a screening of the award-winning documentary Resilience. And our keynote speaker is Heather Forbes, who is a dynamic speaker, author, and she's the co-founder of the Beyond Consequences Institute. And she addresses how traumatic experiences affect the brain and learning, and also talks about the importance of connection with children and addressing behavioral issues from a place of unconditional love and an understanding of neuroscience and the impact of trauma. So we are thrilled that she's coming to bring her energy and expertise to us at the conference.
And to answer your question, why now? Mental health is a hot topic right now, like you said. And so we meet school superintendents, teachers, school officials every day, talking with them every day. And mental health is a #1 concern for their students. They're seeing more and more issues at school. They're struggling more and more with emotional and behavioral sort of health issues. And so they're just needing some help and assistance. They're wanting to learn more and more about what we can do to help these kids.
Do you think some of those things are social media, #1? Because kids deal with things today that they never had to deal with before. So they, like we talked about earlier, they have some body shaming, they have some bullying going on online. And then, of course, we've got in the area a lot of issues with the parents being good parents, because we've got a lot of drug issues and that sort of thing. So
yes, definitely social media. School today is not what school was like when I was there, right? So kids are experiencing so many different things. I'm raising children myself, working with kids every day in a school setting. It's just a different environment, and there's a lot of struggles, a lot of things being thrown at them. Certainly the issues related to parenting, we're seeing more and more trauma, children exposed to trauma, dealing with traumatic events day after day. So the numbers of children who are struggling with mental health, that's on the increase. We're not seeing a decrease in that. And so, yes, I think it's a combination of all of those things.
And Sarah, you're a psychologist.
Yes.
So what are you seeing? What are the issues that you're seeing with the youth of 2019?
A lot of what Amy described, and I think just our role as adults, and one of the things that we are hoping to be able to do with this conference is to come together and to work as a team to be able to support their needs, to be able to understand them and identify and recognize what it is that children are needing, because it really is our responsibility to provide them safe environments and to make them feel significant and to be able to connect with them, because it not only helps their mental health, but it's going to help their educational achievement and lifetime outcomes as well.
do you still see kids connecting as much as they used to, or are they more on their phones and more isolated? Because isolation is not a good thing for anybody, especially kids.
Right.
Do you see that?
Yes, absolutely. And you're absolutely right about that. We need connection in order to thrive. And so there are a lot of barriers to that, including social media and some of the other things that you mentioned. So if we can work to connect with kids and to help them connect with each other, and that's a lot of the things that we will address at the conference will include some of those issues, then it will be helpful for all of us.
So with this conference, who are you wanting to attend? How could somebody find out information and thinking this might be right for their family to attend?
Sure, so it's open to all school professionals. We're looking for teachers, administrators, school board members, anyone who is connecting with a kid or touching a child at school. Definitely parents, grandparents who might be raising their kids. We're going to have resources for anybody who is just hands-on with kids. One thing we say is that if you are in the presence of a child, you are a therapeutic helper. It doesn't have to be a school counselor. It doesn't have to be a licensed counselor. Kids want to talk to their teachers. Teachers are not equipped to deal with that. They go to school to learn education, and they are wanting the help because they love kids and they want to connect with kids. So if you touch a child in any way, you will benefit from this conference.
Oh, that's great. I hope a lot of people show up. Do you want to give the details again, when it is and where it is?
Absolutely. So the conference is on October 21st in Springfield at the DoubleTree Convention Center. It's 8:30 to 4. And we're going to have also 4 different session tracks. So we'll have offerings for school administrators, school counselors, social workers, and other mental health providers, as well as general education teachers, and then special topics too. So it really is open for everybody.
Okay, that sounds great.
Is there a website they can go to?
burrellcenter.com.
burrellcenter.com. Thank
All
you,
right.
ladies.
Thank you, ladies,
Sarah,
so
Amy,
much for
thank
coming
you
in.
so
Thanks
much.
for having us.
Yeah.
I cannot support this effort enough because that we need some mental health
We
help
really do.
in our society today. Ladies, thank you so much.
Thank you so much.
Thank
We
you.
appreciate